Hey everybody, my name's Mike Lovell. I'm going to run through a presentation today. It's kind of like a seminar that we've done in libraries before, a little bit condensed, and you can watch it from comfort of your own home. Basically, it's a beginner's guide to Medicare in Wisconsin. Before we get too far, here is a copy of my insurance license. Upper left-hand corner, you can see is my license number. The red arrow, you can see is my license date. So you know, A, I have a license, and B, I didn't just get it last month. I've been doing this a while. As we get started, first question to come up is, do I need to enroll in Medicare? And this is going to vary depending on if you are receiving your Social Security benefits. So if you have already started receiving those benefits, then you're going to be automatically enrolled into Medicare. You'll get your Medicare card about 3 months before you turn 65. Now, if you're not receiving those benefits and Medicare is going to be your primary coverage, you will need to enroll. I'll talk about how to do that here in a moment. Now, if you're still working or you have coverage through maybe a spouse, a VA, some other way, that's something that we should talk about one-on-one because there can be a lot of moving parts that apply to your unique situation. Now, if you do need to enroll, 3 ways to do that. And you can do this within 3 months of turning 65. So you can go to the local Social Security office. You can call Social Security on the phone, or you can do it yourself online at Social Security's website. It's important to note, enrolling in Medicare is not the same as choosing a Medicare plan. As far as Medicare coverage, Medicare plans, things like that, we're going to start off talking about the 4 parts of Medicare. So original Medicare is made up of Parts A and B. Part A is that hospital insurance, and Part B is medical. Part D is different, and you can add it on where it's prescription drug coverage, and those 3 can work in combination. Or you can look at Part C, which is also known as Medicare Advantage, and that can kind of bundle in those benefits all into one package. But we'll go into more detail on all of these here. So starting with Part A, as long as you've paid into Medicare for 10 years, 40 quarters, then you will not have a premium for your Medicare Part A. But that doesn't mean there's no cost, because if you go to use it, you do have a deductible. For 2019, it's $1,364, and that's what you have to pay before Medicare is going to pay anything. And it's kind of unique because it's a per period deductible. So it's possible that you could end up paying that deductible multiple times per year. Now, after you pay that deductible, there could be some extra co-insurance costs depending on what you're using, because Medicare Part A is going to cover you inpatient in the hospital. And so you'll have co-pays for that if you are inpatient beyond 60 days. Those start about $341 at day 61. But if you're in a skilled nursing facility for rehab type purposes, then those are going to start actually a little bit sooner on day 21, and they're $170.50. Now, Part B is the second part of original Medicare. These 2 work together, and this is going to cover all of your outpatient stuff. So doctor visits, physical therapy, lab work, even actually chemo falls under Part B. Part B does have an extra premium. Most people are going to pay $135.50 a month for 2019. In addition to that premium, you have a deductible. This is $185 for 2019, and that's what you have to pay before Medicare is going to pay anything for Part B. Now, after you meet that deductible, Medicare will pay 80%, and you have to pay 20%. It's kind of unique, though, because Medicare is different from many other health insurance plans that you've probably had before, where they have what's called a maximum out of pocket. And if you have a maximum out of pocket, once you hit that for your spending for the year, your insurance plan will pay 100%. But Medicare does not have that. So you will owe 20% for your Part B, no matter how big the bill is. If it's $100, you'll owe $20. $10,000, you'll owe $2,000. But if it's $100,000, you're going to be on the hook for $20,000. So you can see it adds up quick, and that is a big exposure. So how can you limit that exposure? One way is with a Medicare Supplement. Now, we're unique here in Wisconsin. 47 states decided to do their Medicare supplements a certain way. 3 states opted out of that. We are one of them. So we're the only one that does our supplements this way. We have a base plan, and then we have riders that you can add to it to give you varying amounts of coverage. Now, if you add as many as you can, you're going to have a very comprehensive plan at a higher premium. As you scale back some of those riders, you'll have a lower premium, but you'll have some extra costs when you actually use the plan. So it's also important to note, because there's about 30 some companies here in Wisconsin offer Medicare supplements, and they're all standardized. So they all offer the same plans. If you've added the same riders, they work identical format. There's no differences in the doctors that you can see, the hospitals. There's no networks at all. So you can go see any doctor. You're not restricted in any way. But the price that they pay for that can be very different. And on the screen here is an example of how that looks. Here are 4 different companies. I've labeled them A, B, C, and D. And you can see copays. You go see your primary care doctor, $0. Now, this is the comprehensive plan that's going to cover the deductibles, the copays, co-insurance, everything. That's how these plans work, and they're all the same. You can go see any doctor. Specialist, $0. That's what you pay. The insurance company's going to pay the rest. Inpatient, you pay 0. But the monthly premium that you're going to pay for this, one company could charge $120. Another one could be $138, or you could look at company D that charges $211. So this is not one of those cases where you pay more to get more. You're paying more to get the same if you were to take Part D. So it doesn't really make sense to do that. Part B is something that covers prescription drugs, because original Medicare and Medicare supplements do not have any prescription drug coverage built in. So Part D is what you add in to that. It's going to be sold by insurance companies typically, and there's varying costs that include the monthly premium, deductible, which would be what you'd have to pay before you'd have any copays or anything that would be covered by the insurance company. Any copays that you have for the prescriptions. They also vary in which medications are covered. So one plan might not cover your medications, but another one will, and another one might cover them, but at a much higher rate. So it's important to look at those and to kind of compare what you're taking to look at what you're going to get for the value. Average premium for a Part D plan is about $30 to $35 per month. So this brings us to your first main option as far as getting your Medicare coverage. And that's staying with original Medicare, which is what we talked about, that Parts A and Parts B. Getting a Medicare supplement. If you go the comprehensive route, you're looking at about $150 a month on average. I can get you specifics, but on average, that's a good ballpark to start with. And about $35 a month for that Part D plan. So adding in with your Medicare Part B premium, you're looking at about $320 a month, but you're not going to have any deductibles. You're not going to have any co-pays except for your prescriptions. And when you go to the doctor, you're just going to show them your cards. It's going to be all covered. But your also important fact is that you can go see any doctor or hospital that you want. You're not restricted by a network or where you can go. So if you have ever had experience where you're seeing your doctor and then a doctor's no longer network and you can't see them anymore, you don't have to worry about that with this option. So that's a big difference. But you're paying the monthly premium no matter what. It can be easier to budget, but it is also something that you're paying whether you're using it or not. On important note, it's also guaranteed renewable. So you can keep this plan as long as you want, but the premiums can increase. Now, the second option is going to be Part C, which is also known as Medicare Advantage. And this is going to take your Medicare benefits. So you're going to get your Medicare benefits from an insurance company instead of the federal government. So it's going to combine Parts A and Parts B, and usually Part D, all into one, and you'll use that one ID card for this. Insurance companies, like I said, is going to cover those benefits, and they're going to set up a network of doctors that you need to stay in to get the full benefits from the insurance company. Otherwise, it's possible they'll pay less or nothing, because they usually set up in a network style as far as an HMO, where you may need referrals to go see a specialist. You might not have any coverage whatsoever outside of the network of doctors. So you're definitely more restricted. Typically, you're going to have a lower premium or possibly even no premium, but it's more of a pay-as-you-go plan because as you use the plan, as you get treatment, you're going to have co-pays, deductibles, co-insurance, depending on what it is. And then they typically have maximum out-of-pockets. CMS, which is Centers for Medicare and Medicaid, has set the maximum that you can have in network at $6,700, so $6,700. If you were to hit that, then the insurance company would pay 100%. But again, that's in network. Out of network, there might not be any cap, or it might be higher. So looking high level at Medicare Advantage, you still have to pay that $135.50 a month for Part B. But then you have your Medicare Advantage premium, which varies by company, but could be as low as $0. And then you'll have co-pays for when you use the plan. Maybe be primary care physician, specialist, emergency room. Basically, you'll have costs each time you use the plan. You do have that maximum out of pocket. So if you have a poor year health-wise and you reach that, the insurance company will pay 100%. So you can see it can be a lower premium overall compared with the supplement. But I guess that means you have the potential to save money, but you also have the potential to spend more money because if you hit that maximum out of pocket, it would be higher. You're also, for the potential to save money, you have some trade-offs, such as the pay-as-you-go model, but also limiting yourself to be able to stay in a network of doctors. So you have less choice, less freedom that way. Also, big important note is these plans are set for the calendar year, so it is possible for them to change, whether it's the premium, the benefits like the deductible that you'd have to pay or the co-pays that you'd have to pay. Networks can even change. So a doctor could be in network now, but could fall out of the network in the future, and then you'd have to either pay for that on your own or go see a different doctor who's in network. So that's a big difference between the Medicare Advantage route and the original Medicare with a supplement route. This is from the Wisconsin Guide to Medicare, and it really talks about what I was just saying there. And you can see the two red notes. Medicare Advantage plan can terminate, so the plan could actually end at the end of the calendar year. Also, they're not regulated by the insurance department. It's more CMS. So there are certain benefits that we have in Wisconsin that don't necessarily apply to Medicare Advantage plans, but would to original Medicare supplements. So here's kind of high-level key points. Original Medicare plus a supplement, you can go see any doctor. You're not restricted in any way. Medicare Advantage, you need to use network providers, or else you'd have reduced or no benefits. Usually, from original Medicare, do not need a referral. Medicare Advantage, you may need a referral to see a specialist. Medicare Supplement, original Medicare, going to be a higher premium, and it's going to be paid no matter what, so you can kind of budget on that. But you're not going to have any extra expenses when you go to the doctor. Medicare Advantage could be a lower premium, but it's more of that pay as you go, so you'll have deductibles, co-pays, co-insurance as you use the plan. Common question that comes up: premiums. How am I paid? What do I like? Do I pay for you? And the answer is, I am free to you. So insurance companies set their plan premium. So let's say if it's company A, for example, and you want to buy that plan, however you buy that plan from company A, you're going to pay the same for it, and you're going to get the same benefits. So if you were to go online and sign up direct with that company to cut out the middleman, you're going to pay the same premium. If you were to use an agent or to call into the company, use a licensed agent on the phone or one of their agents that are like employees are only offering that plan, then you're still going to pay the same. If you use an independent agent like myself, you're going to pay the same. So no more, no less. The prices are set. But with me, you get to call me, and I'm one call away. I'm not a press one phone prompt person. So if you were to try to not use an agent, you will not save any money. When you call into the insurance company, you're going to call a 1-800 number. So it's going to be some person sitting in a call center. You probably never talk to them. And if it's ongoing, maybe you have to call 2 or 3 times. The odds are not good that you're going to get the same person that you talked to in that call center again back on the phone. So each time you call, probably going to have to start over. With me, you will communicate with me, and I will handle things for you as best as I can. That way you don't have to spend your time going through phone prompts or waiting on hold. As far as when to enroll, around 65 is an important date because there's a 7-month window when you can sign up for Medicare called your initial enrollment period. That's when you sign up for Medicare, and you're also going to have a window of opportunity where you can sign up for a Medicare Supplement without any health questions. So that's important because after that window is done, if you want to change Medicare supplements or change to a Medicare supplement, you may have to pass an underwriting review. So they'll ask you health questions and they could possibly deny you coverage. So you're making it harder for you to change. There is the annual enrollment period every year, runs from October 15th to December 7th. And that's when you can change your prescription drug plans, or if you want to change your Medicare Advantage plan or change to a Medicare Advantage plan. You can do it during that window, and it will take effect January 1st. There's also special enrollment periods. There's a number of them. They vary, and there's usually a limited window, many times 60 days, that you have to take advantage of that. So if you have a situation where you're moving or something else is going on, reach out to an agent right away for help. This is talking about if you can change your plan later. And with Medicare supplements, if you want to change from one to another, like I said, you'll have to pass an underwriting review after that first window is over around turning 65. And you can do that as long as you can pass the underwriting review any time of the year. So you're not necessarily locked in that way. If you have a Medicare Advantage plan, you want to change to a different one, or if you want to change and try to go back to original Medicare and get a supplement, then you can do that during the annual enrollment period, but you'll still have to pass an underwriting review to get that Medicare supplement. But either way, you would be able to drop back to original Medicare and pick up a prescription drug plan if you wanted to go that route during the annual enrollment period. A couple things that are important to know about what's not covered by Medicare. Dental is a common one that's asked about. Vision, both of those, like cleanings, eye exams, dentures, crowns, fillings, not covered by Medicare. Another big one is long-term care. Many people might have heard of it as like nursing home coverage. That's not going to be covered by Medicare. So if you have questions about these concerns, let me know. We can talk about that one-on-one. And that's basically it today. That gives you a high-level overview of Medicare, time frame, especially as you're turning 65. If you have questions or you want a free report based off of you and your numbers in the area that you live as far as looking at Medicare supplements, Medicare Advantage, prescription drug plans, just reach out to me and I'll be happy to help and communicate with you however you prefer. Again, my name's Mike Lovell. Phone number is 608-571-4461. You can email me, Mike, at askmedicaremike.com, or just head on over to my website, askmedicaremike.com. Thanks. Have a great day, everyone.